Welcome to this short webinar on the Illinois Medicaid coverage of therapy services. My name is Zachary Edgar, and my company is called Therapy Comply. Therapy Comply is a membership-based compliance firm dedicated to assisting physical, occupational, and speech therapy practices and facilities. Members can access a wide selection of guides, sample policies, and forms on Medicare, Medicaid, HIPAA, TRICARE, and state rules and regulations that apply to therapy practices. Members can also email me at any time with any compliance or billing questions or schedule a phone call. Please visit the website at therapycomply.com for more information. This presentation is for informational purposes only. None of the material is intended as legal advice. Statutes and regulations are all subject to change. This presentation describes the Illinois Medicaid fee-for-service coverage of therapy services. Medicaid managed care companies must offer the same amount of care as the state, but can change prior authorization, personnel, and documentation guidelines. MCOs do follow the state rules in many cases, but therapists should always double-check with the managed care organization. On the website, we offer more detailed information on outpatient therapy services, have fee schedules and code lists, billing for non-covered services, qualified Medicare beneficiaries, MCO plans, and members can always request information or ask questions about any Medicaid coverage and compliance issue. Illinois Medicaid enrolls individual therapists as well as hospitals billing for salaried therapists in the outpatient hospital on-site setting and hospitals billing for salaried therapists in off-site clinics that are within 35-mile radius of the main hospital campus. Therapy service providers must meet one of the following criteria to be considered for enrollment to participate in the department's medical program. A physical therapist who is licensed by the Illinois Department of Financial and Professional Regulation and/or licensed in their state of practice. Same with an occupational therapist. And an SLP who is licensed in Illinois or their state of practice or has completed the academic requirements as in the process of accumulating the necessary supervised work experience required for licensure, i.e. the clinical fellowship year. An enrolled therapist may only charge for services he or she personally provides or for services provided by a licensed therapy assistant under the supervision of the enrolled therapist. Speech-linguist pathologists may also charge for services provided by individuals in their clinical fellowship year. A written recommendation signed and dated by the patient's practitioner, an MD, DO, APN, physician assistant, or chiropractor, only working within their scope of practice, is required for the provision of therapy services. Either electronic or handwritten dates are acceptable. Orders transmitted by telefax or electronically are acceptable, provided it is clear from the contents that the practitioner personally signed and dated the original order. Multiple page orders must have the patient's name on every page. Therapy is limited to addressing the diagnosis included in the practitioner's written order. Services should be provided for participants because of illness, disability, or infirmity in accordance with a plan of care established by a therapist in conjunction with the ordering practitioner. The practitioner order must include the name of the patient, the diagnosis, the specific therapy discipline, the date, and signature of the practitioner with their credentials. The practitioner's order must indicate the specifications for the therapy services. The order must be unique to the patient. A generic or template version of an order will not be accepted. It is the responsibility of the requesting provider to have the practitioner orders on file for therapy services rendered. Orders are valid for 12 months. Prior to the end of the initial certification, the therapist should reevaluate or reassess the participant to certify therapy continues to be medically necessary and appropriate. If a participant needs further therapy, a new plan of care, and a request for prior approval must be submitted to the department. Covered occupational therapy services include medically necessary evaluations and treatment by a licensed OT when services are required because of an illness, disability, or infirmity limits functional performance, and occupational therapy services will improve functional skills performance. Covered services include, but are not limited to, activities of daily living, when occupational therapy services will increase independence and or decrease the need for other support services. Services must be provided in accordance with the definite plan of care established by the therapist for the purpose of attaining maximum reduction of a physical disability and restoration of the client to an acceptable functional level. Covered physical therapy services include medically necessary evaluations and treatment by a licensed PT when services are required because of an illness, disability, or infirmity limits functional performance, and physical therapy services will improve functional skills performance. Covered services include, but are not limited to, activities of daily living when physical therapy services will increase independence and/or decrease the need for other support services. Services must be provided in accordance with a plan of care established by the therapist for the purposes of attaining maximum reduction of a physical disability and restoration of the participant to an acceptable functional level. Covered speech therapy services include medically necessary evaluations and treatment by a licensed speech language therapist when services are required because of an illness, disability, or infirmity limits functional performance, and speech therapy services will improve functional skills performance. Covered services include, but are not limited to, activities of daily living when speech language therapy services will increase independence and/or decrease the need for other support services. Services must be provided in accordance with a plan of care established by the therapist or clinical fellow for the purpose of attaining maximum reduction of a physical disability and restoration of the participant to an acceptable functional level. Therapy is for the purpose of attaining reduction of a physical disability and/or restoration of the individual to an acceptable functional level. Services provided for the general good and welfare of participants, such as fitness exercises and activities to provide diversion of general motivation and maintenance therapy to maintain the current level of function are not covered. Treatment related to recreational, sports, leisure goals that does not demonstrate medical necessity is not covered. Therapy services should not replace a home exercise program that can be demonstrated and implemented by the participant and/or family members. For therapy services, the basic record must include the current practitioner's order signed by a physician, MD, DO, or DC, advanced practice nurse, or physician assistant, clinical diagnosis, if not included in the practitioner's order, participant's name, recipient identification number and address, initial assessment and treatment plan, progress reports, approved prior authorization requests if applicable. Prior approval by the department is required for the provision of all therapy services except when the service is approved by Medicare, reimbursed by an MCO or MCCN, speech therapy rendered to a child through the age of 20, or a therapy evaluation visit. Prior approval requests must contain documentation for department staff to make a decision on medical necessity, appropriateness, and the anticipated patient benefits of the service. The single most common reason for a delay in processing prior approval requests is a lack of adequate information upon which to make an informed decision. Decisions must be made within 30 days of the receipt of a properly completed request, with exceptions as described below. If a decision has not been made within a 30-day period, the service is automatically approved, but for a minimum time period. If a service has been automatically approved, reimbursement will be made at the provider's charge or the department's maximum rate, whichever is less. If the service requested is denied, a computer-generated Form HFS 3076C Notice of Decision on Request for Therapy, citing the denial reason, will be sent to the patient and the provider. The provider cannot file an appeal of the denial. Only the patient may file an appeal. If the provider obtains additional information that could result in a reversal of the denial, the provider may submit a new prior approval request with the supporting medical information attached. Therapy approvals are not transferable. They are specific to a participant and to a specific provider. The department will end the prior approval, and the new provider can then submit a prior approval request under its name and provider NPI with the medical justification. To be eligible for post-approval consideration, all normal requirements for prior approval of the item must be met, and the department must receive the post-approval request no later than 90 days from the dates of service were provided or within the time frames identified above. Providers have 180 days from the date of the post-approval to bill the department. Thank you for watching, and please visit the website for a lot more information at therapycomply.com.